Welcome to the Dove Education Network Research Institute Report 2024. Today, the Dove Education Network presents a presentation for the test for relationship. My name is Dr. Elizabeth Barkley. I am a quantitative clinical researcher. Today, I will be presenting on the obesity epidemic, which is part of my larger health education series under the Dove Education Group. The goal of this presentation is to highlight the urgent need to address the global obesity crisis through research-driven initiatives, with a specific focus on the public health impacts of obesity and strategies for better healthcare outcomes. Many researchers, the lay public, governments, initially focus highly on the nutritional aspect of obesity, whether a person had the nutrients, whether they were overeating some products that was promoting the effect of it in their bodies. The focus on nutrition and how obesity relates to nutrition has been misunderstood and underrepresented for many years. In this study, I hope to reveal some truths and dispel some myths that obesity is not a nutrition based disease alone, that there are co-relationships and partnerships that need to be addressed. In 2000, the World Health Organization declared that obesity rates regionally, globally, went sky high, and the numbers have been climbing since in different parts of the world. Obesity has said to be affecting 890 billion people worldwide, representing 1 in 8 individuals. Currently, obesity affects over 890 billion people worldwide, and representing 1 in 8 individuals will be diagnosed with obesity. The financial burden is staggering, with global healthcare spending estimated between 2 to 7%. And in the US, this figure reaches $147 billion annually. Obesity not only impacts personal health, but it also has seen across healthcare streams, across several other industries, which is why it's critical for science, for researchers, for medical practitioners, for the lay public to look at this story of obesity as a conglomerate all over across the world and address the root causes, dispel the myths, and hopefully implement effective treatment plans and options. This means that we need to ask some questions here. If obesity is affecting every culture and every system in the world, some look higher than others, some seem to be managing, others seem to be growing exponentially, then the question is it a nutritional factor? Are there biological factors? Or are there other determinants that we may not be considering as a growing underlying current that is now surfacing across the world? Obesity does not just occur in isolation or because you eat fruits or package it a certain way. It is not an isolated condition. Social determinants of healthcare, such as socioeconomic status, education, access to foods and vegetables, and all types of determinants, play a significant role in the prevalence of obesity. So, whether someone eats good fruits or drinks the right juice or has a good growing ground, we have no evidence at this time through the literature, it is lagging, that this alone will be the panacea or the cure for conditions or co-conditions with obesity. While it is very good nutrition to have these within our diet, this does not prove why across the world we have issues going on an individual and as a societal form. While many have moved the dial on obesity, from it's caused by motivation, it's dieting, it's lack of fitness, if they just lose weight, then they will be better. Many have played this. There have been many programs, many resources gathered that this will be the optimal fit. There are many authors, many researchers have come up with what they feel are the panacea or the cure for their belief systems that obesity is caused by one thing or the other. In preventive medicine, obesity is looked at as contributing to the higher rates. Understanding these determinants will help us shape more equitable healthcare policies and interventions than just a guesswork or dialing what could have caused this now. Scientific inquiry into obesity is increasing, and here's why. BMI, body measurement instruments, have been used widely to measure why we say someone is obese. In clinical settings, scientific inquiry has even looked at the genetic factors, coding, recoding, and wondering, are there triggers occurring from DNA that is causing the problem? Or are there other genetic markers that we can look to as solutions to solve the problem? These are very good thoughts to have, and you may have your own at this point. If we're looking at lifestyle, genetics, habits, how does this occur? In many of the studies I've researched in my literature review, I found that there was a lot of misclassification of healthy versus unhealthy behavior, of good versus not so good behavior for people themselves. Very seldom was the system itself looked at that the individual was in. Very seldom did I read reports that said that it's a total system that must move in order to resolve this crisis. And interestingly, the risk factors involved with obesity mostly looked at comorbid conditions or co-affecting conditions of the behavior of the person. As a result, there's very little look at the science of studying obesity, how we're getting the information, and whether there's true relationship to every variable that we are calling the cause of this condition. These critical conversations and areas have led to the need for us to explore more comprehensively all factors, genetics, metabolic data, and also getting a fuller picture of people and what is happening in their world, the social ecological patterns around their world, what is happening when there's treatment and when there's lack of treatment, and also who is doing and who is saying what is occurring. And since right now there's very critical questions of relationship factors, what are the relationships that are occurring for us to gather this information? Are there relationships? Some people get on diets and say, I don't even know if it's going to work. I don't even think it works. How can I sustain it? These, again, are very good questions, but they're diving into why I committed to doing this study. Historically, previous approaches have looked at obesity treatment from the modern approach versus the traditional means and practices that have been recorded over time. And this war between the evolution of obesity treatment between traditional versus biogenetic approaches using drugs, using nutritional control factors, using exercise methodologies, historically seem to be the focus of lifestyle interventions, such as the dieting, exercising, behavior changes. However, as our understanding of obesity, health conditions, and other diseases has evolved using genetics and bioeugenics, it is clear that obesity is not solely a personal choice. Current biogenetic research shows that genes play a significant role in an individual's susceptibility to obesity. Genetic markers can indicate a predisposition to weight gain, making personalized interventions difficult. Nutrition using genetics or nitrogens and gen targeted therapies also, while promising, may also be triggering other factors for some individuals and curing others. And this we don't know why. What is the relationship that is occurring? At Dove Education Network, we empower justice. We never rest with the first result. We will provide follow up studies. We will provide opportunities for focus groups to come together and continue this very powerful discussion on obesity so that we may be able to find even more relationships. And maybe we will find programs who encompass a comprehensive view of obesity that they've come up with a treatment or individuals have discovered their genetics tied to their socio-ecological factors is producing results. I'm interested in many more follow ups, and we will produce many more shows to provide this forum. Thank you for joining me in my study that I conducted for the American education so that we may be able to empower justice through information.